In this lecture, we will review the topic of sexual behavior in adolescence, to include sexual interactions, teenage sexual activity trends, risky sexual behaviors, and the two main approaches towards sex education. Developing sexuality is an expected and natural part of growing into adulthood. Healthy sexual development involves more than just sexual behavior. It is the combination of physical sexual maturation, like puberty and age-appropriate sexual behaviors, the formation of a positive sexual identity, and a sense of sexual well-being. During adolescence, teens strive to become comfortable with their changing bodies and to make healthy, safe decisions about which sexual activities, if any, they wish to engage in. Teen sexual health outcomes over the past decade have been mixed. On one hand, teen pregnancy and birth rates have fallen dramatically, reaching record lows. But on the other hand, rates of sexually transmitted infections, also known as STIs, among teens and young adults have been on the rise. Many schools and community groups have adopted programming that incorporates abstinence of sexual activity as the approach to reduce teen pregnancy and STI rates. According to KFF Health Policy Research, there are two main approaches towards sex education: abstinence-only and comprehensive sex education. These categories are broad, and the content, the methods, and the targeted populations can vary widely between programs within each model. In general, abstinence-only program, also known as quote-unquote sexual risk avoidance programs, teach that abstinence from sex is the only morally acceptable option for youth and the only safe and effective way to prevent unintended pregnancy and STIs. They generally do not discuss contraceptive methods or condoms unless to emphasize their failure rates. Comprehensive sex education is more diversely defined. Most generally, these programs include medically accurate, evidence-based information about both contraception and abstinence, as well as condoms to prevent STI transmission. Now, I know this topic is highly controversial. However, I must put this information out there in my educational learning video lectures. Now, some programs known as Abstinence Plus stress abstinence is the best way to prevent pregnancy and STIs, but also include information on contraception and condoms. Other programs emphasize safe sex practices and often include information about healthy relationships and lifestyles. Now, in regards to sexual interactions, many early social interactions tend to be non-sexual, like text messaging, phone calls, email. But by the age of 12 or 13, some young people may pair off and begin dating and experimenting with kissing, touching, and other physical contact, such as oral sex. Now, based on societal or cultural norms, this practice may vastly differ. Some cultures emphasize waiting until marriage before any sexual activity can occur. The vast majority of young adults are not prepared emotionally or physically for oral sex and sexual intercourse. If adolescents this young do have sex, they are highly vulnerable to sexual and emotional abuse, sexual transmitted infections, also known as STIs, HIV, and early pregnancy. For STIs in particular, adolescents are slower to recognize the symptoms, tell their partners, and seek medical treatment, which puts them at risk for infertility and even death. Adolescents age 14 to 16 understand the consequences of unprotected sex and teen parenthood if properly taught. But cognitively, they may lack the skills to integrate this knowledge into everyday situations or consistently to act responsibly in the heat of the moment. By the age of 17, many adolescents have willingly experienced sexual intercourse. Teens who have early sexual intercourse may report strong peer pressure as a reason behind their decision. Some adolescents are just curious about sex and want to experience it. Becoming a sexually healthy adult is a developmental task of adolescence that requires integrating psychological, physical, cultural, spiritual, societal, and educational factors. It is particularly important to understand the adolescent in terms of their physical, emotional, and cognitive stage. Additionally, healthy adult relationships are more likely to develop when adolescent impulses are not shamed or feared. Guidance is certainly needed, but acknowledging that adolescent sexuality development is both normal and positive would allow for more open communication so adolescents can be more receptive to education concerning the risks. Adolescents are receptive to their culture, to the models they see at home, in school, and in the mass media. The observations influence moral reasoning and moral behavior. Decisions regarding sexual behavior are influenced by teens' ability to think and reason, their values, and their educational experience. Helping adolescents recognize all aspects of sexual development encourages them to make informed and healthy decisions about sexual matters. Now let's review some teenage sexual activity trends. Teenagers are much more sexually active today than they were before the sexual revolution of the 1960s and 70s. About 43% of never married teens ages 15 to 19 of both sexes have had sexual intercourse. This percentage represents a drop from its highest point in 1988 of about 51% of females and 60% for males. In my lecture, I usually throw a lot of statistics out there because I think it's highly relevant for you to know. So, about 3/4 of girls in today's sexually experienced group and 85% of boys in this group use contraception, most often a condom, the first time they ever have sex. In their most recent act of sexual intercourse, almost 86% of girls and 93% of boys used contraception, again, most often a condom. If 43% of teens have had sexual intercourse, that means the majority of teens, 57%, have never had intercourse. This is interesting to examine their reasons. The top reason for both sexes is religion and morals, followed by concern about a possible pregnancy and not having found the right person with whom to have sex with. Okay, let's move on to youth engage in sexually risky behaviors. This is according to the Center for Disease Control. Many young people engage in health risk behaviors and experiences that can result in unintended health outcomes. CDC data show protective sexual behaviors, for example, condom use or sexually transmitted disease testing and HIV testing. Experiences of violence, mental health, and suicidal thoughts and behaviors worsened from 2011 to 2021. Now, among U.S. high school students surveyed in 2021, 30% had never had sexual intercourse. 48% did not use a condom the last time they had sex. 8% had been physically forced to have sexual intercourse when they didn't want to. 9% of all students have ever been tested for HIV. 5% of all students have been tested for sexually transmitted diseases during the past year. Now, schools and youth serving organizations can help, according to the CDC. But how, might you ask? Well, school health programs can help young people adapt lifelong attitudes and behaviors that support their health and well-being, including behaviors that can reduce their risk for HIV and other STDs. HIV, STDs, and teenage pregnancy prevention programs in schools should provide health information that is basic, accurate, and directly contributes to health-promoting decisions and behaviors. They should address the needs of youth who are not having sex, as well as youth who are currently sexually active. They should ensure that all youth are provided with effective education and skills to protect themselves and others from HIV infections, other STDs, and unintended pregnancies. They should be developed with the active involvement of students and parents. They should be locally determined and consistent with community values and relevant policies. Now, again, there are two main approaches towards sex education: the abstinence-only and comprehensive sex education. These categories are broad, and the content, methods, and targeted populations can vary widely between programs within each model, and also can vary widely between societal and cultural norms.